Today, we're delving into the topic of joint pain, focusing on the 7 foods that can exacerbate discomfort in areas like knees, hips, and feet. We'll be supporting our discussion with robust scientific studies. But fear not, we won't leave you hanging. As a bonus, we'll provide you with a list of the best foods to replace those culprits. And rest assured, it's not just about vegetables. Stick around till the end because we'll be sharing evidence-based dietary adjustments that can significantly alleviate joint pain. Let's begin by understanding the various types of arthritis. First on the list is osteoarthritis, characterized by the gradual loss of cartilage in the joints. While weight has historically been implicated, there's more to it. Metabolic factors play a crucial role too. Then there's gout, a condition marked by the accumulation of uric acid, typically affecting joints like the big toe, ankles, and feet. Certain foods can trigger gout by promoting the formation of sharp crystals within the joint. Additionally, autoimmune diseases like rheumatoid arthritis, lupus, and psoriatic arthritis involve the body's immune system mistakenly attacking its tissues, leading to inflammation and joint damage. Managing inflammatory cytokines, which are immune system proteins, is key to mitigating these conditions. Lastly, let's not forget about diabetes. High blood sugar levels not only impact metabolic health, but also contribute to tendon stiffness. This can exacerbate joint issues, further complicating matters with the formation of sharp crystals in the joints. By understanding these underlying mechanisms and making informed dietary choices, we can take proactive steps towards alleviating joint pain and improving overall well-being. We'll begin our discussion with processed foods and meats, focusing specifically on meats such as lunch meats, bacons, ham slices, jerkies, and smoked meats. These products contain compounds known as ages, which accumulate in the body and have been linked to increased inflammation. This inflammation, marked by elevated levels of pro-inflammatory cytokines, not only contributes to joint pain but has also been associated with conditions like colon cancer, highlighting the broader health implications of consuming these foods. Studies have shown that the consumption of processed meats can lead to higher levels of interleukin-6, homocysteine, and C-reactive protein, further exacerbating inflammatory responses in the body. Therefore, it's advisable to limit intake of processed meats to reduce the risk of inflammation-related health issues. In contrast, opting for lean, unprocessed meats can provide essential nutrients without the detrimental effects associated with processed counterparts. Embracing healthier meat options aligns with overall well-being and supports joint health in the long run. Number 6 on our list is alcohol. While some studies suggest that moderate alcohol consumption, particularly in the context of the Mediterranean diet, can offer health benefits, it's important to understand the recommended limits. For women, the advised maximum is 2 glasses per day, while for men, it's 3. This equates to about 10 drinks per week for women and 15 for men. However, it's worth noting that these limits may seem somewhat high to some individuals. Excessive alcohol intake can lead to various health concerns, including increased levels of pro-inflammatory cytokines and markers, which contribute to inflammation in the body. Additionally, alcohol can negatively impact gut health, potentially leading to a condition known as leaky gut. This condition hinders the absorption of essential nutrients, further exacerbating inflammation. In summary, while moderate alcohol consumption may have its benefits, it's crucial to be mindful of the recommended limits and to prioritize overall health by avoiding excessive intake. Number 5 on our list brings attention to processed carbohydrates and their impact on our health. The glycemic index acts as a yardstick for measuring how quickly certain foods raise blood sugar levels. Foods with higher glycemic index values cause blood sugar levels to spike more rapidly. These foods often contain simple sugars, like those found in donuts, which can have negative effects on our health. Let's compare a donut to an avocado. A donut ranks high on the glycemic index due to its sugary content, while an avocado contains a significant amount of fiber, around 90%, with only 11 grams of carbohydrates, most of which, 10 grams, are fiber. Avocados lead to a slower release of sugar into the bloodstream. This helps maintain better control over blood sugar levels. Consuming foods with a high glycemic index not only increases the risk of diabetes, but also raises sugar levels in the bloodstream. This excess sugar can stiffen tendons, worsening joint pain and discomfort. Moreover, inadequate fiber intake can cause digestive issues like hemorrhoids, underscoring the importance of prioritizing fiber-rich carbohydrates in our diet. To minimize these risks, choose fruits and vegetables, which typically have lower glycemic index values. Conversely, limit intake of refined carbohydrates such as bread, pastries, flour, sugar, soft drinks, and pasta. These foods lead to rapid spikes in blood sugar levels. By making thoughtful dietary decisions, we can support joint health and overall well-being. Number 4 is vegetable oils and seed oils, a topic that often sparks controversy, and I've found myself amidst heated discussions on this matter. The debate between good oils and bad oils is far from black and white. However, a key factor to consider is the omega-6 fatty acid content. While omega-3 fatty acids are more widely recognized, omega-6 fatty acids also play a significant role. These omega-6 fatty acids have been linked to inflammation in the body. Ideally, the ratio of omega-3 to omega-6 should be around 1:1 to maintain a balanced inflammatory response. Unfortunately, the reality is quite different. The average American diet skews heavily towards omega-6 fatty acids, with a staggering ratio of about 25:1 compared to omega-3. This imbalance contributes to heightened inflammation and a deficiency in anti-inflammatory properties. It's essential to address this imbalance by incorporating more sources of omega-3 fatty acids into our diets while reducing the consumption of omega-6 rich oils. By doing so, we can strive towards a more balanced inflammatory profile, promoting better overall health and well-being. Hydrogenated foods constitute a category of processed fats prevalent in various culinary offerings, including microwavable popcorn, margarine, fried foods like French fries, as well as a spectrum of baked goods such as cakes, cookies, and pastries. Despite their widespread appeal, it is crucial to recognize their association with trans fats, which present significant health concerns. Recent studies have shed light on the contrasting effects of different types of trans fats. While traditionally considered detrimental to health, trans fats derived from sources like lean-cut meats and dairy exhibit comparatively milder impacts on the human body. Unlike their processed counterparts, these naturally occurring trans fats undergo metabolic processes within the body, rendering them more compatible with physiological functions. Conversely, the artificial trans fats found in hydrogenated foods pose a greater risk due to their resistance to breakdown mechanisms in the body. This resistance not only disrupts metabolic pathways, but also contributes to the accumulation of adipose tissue, particularly around the waist, thereby exacerbating conditions such as metabolic syndrome and diabetes. Moreover, a diet rich in these unhealthy fats has been implicated in promoting systemic inflammation, further underscoring the imperative of dietary moderation and prudent food choices. By prioritizing whole, unprocessed foods and minimizing consumption of hydrogenated fats, individuals can mitigate the adverse effects on metabolic health and overall well-being. Number 2 on our list is high fructose corn syrup, a prevalent ingredient in many processed foods. Comprised of 45% glucose and 55% fructose, high fructose corn syrup is found in abundance in the Western diet, particularly in desserts, sugary snacks, cheap cereals, cookies, and sodas, with sodas often taking the top spot. Consuming products containing high fructose corn syrup essentially means ingesting pure sugar, which can have detrimental effects on health. Studies have shown a direct correlation between high fructose corn syrup consumption and increased levels of inflammatory cytokines, markers in the body associated with inflammation. Additionally, research involving high fructose diets in mice revealed elevated rates of cancer, emphasizing the potential risks associated with this ingredient. In contrast, clinical trials comparing the effects of sodas, milk, and water on inflammatory markers demonstrated that sodas had the most adverse impact. While opting for diet soda may seem like a healthier choice, it's important to note that it still contains artificial sweeteners and may not be entirely benign. The repercussions of high fructose syrup consumption are manifold, ranging from obesity and insulin resistance to diabetes, fatty liver disease, and even cancer. Considering these risks, reducing intake of high fructose corn syrup is advisable for promoting overall health and well-being. The number 1 dietary consideration for managing gout is crucial, Gout arises primarily from the accumulation of uric acid in the body. To mitigate its effects, maintaining proper hydration levels is paramount. Avoiding foods high in sugars, particularly those found in soda, is imperative. Additionally, reducing intake of fatty meats, shellfish, crustaceans, and sweetened foods and beverages is advised. In terms of dietary choices, opting for low-sugar options such as vegetables, cherries, dark berries, and low-fat dairy products is recommended. It's vital to prioritize hydration by consuming ample water and steering clear of foods that promote dehydration, such as alcohol. Furthermore, minimizing consumption of meats rich in cells, which are challenging for the kidneys to process, is advisable. By adhering to these dietary guidelines and steering clear of sugary beverages, high-sugar foods, and refined products, individuals can take proactive steps towards alleviating the symptoms of gout and enhancing overall health and well-being. Now, we're going to get into what you should be eating instead. Here are some scientifically proven strategies to alleviate joint pain and arthritis. Firstly, consider incorporating turmeric and curcumin into your diet. These spices, commonly used in Indian cuisine, have been shown in high-level studies to reduce inflammation in joints. The average Indian diet contains around 2,000 milligrams of these compounds, surpassing what most supplements can provide. In addition to turmeric and curcumin, ensure you're consuming ample fresh fish and other sources of omega-3 fatty acids. While omega-3s can also be found in vegetables, they are typically more concentrated in fish like salmon and freshwater varieties. Aim for a balanced ratio of omega-3 to omega-6 fatty acids, as an imbalance can exacerbate inflammation. Be cautious when opting for supplements, as some may contain disproportionately high levels of omega-6, negating the benefits of omega-3s. Green tea extract has also shown promise in alleviating joint pain. Numerous studies have demonstrated its anti-inflammatory properties, making it a valuable addition to your dietary regimen. Furthermore, consider incorporating collagen supplements and other joint-supportive nutrients into your routine. Collagen, in particular, plays a crucial role in maintaining joint health and mobility. If you found these tips helpful, consider sharing this information with friends or loved ones who may also be dealing with joint pain. Remember, taking proactive steps to address arthritis can significantly improve your quality of life. Take care and move forward in your journey towards better joint health.